subscribe and press the bell icon to never miss an update from CalmSage.
Top 5 myths about therapy. If you have ever decided to seek help from mental health professionals, there might be some doubts popping in your head. Let us clear them by addressing the most common myths about therapy. Myth 1. Only weak people or people with serious issues seek therapy. Fact check. That's not true. Seeking treatment represents resourcefulness and shows that you care for yourself. It doesn't mean you're weak at any point. Myth 2. Therapy is all about cheerleading. Fact check. Well, that's not the only outcome of therapy. It is the job of a therapist to encourage you, be empathetic, and guide you through the problematic areas of your life. But this doesn't make them cheerleaders alone. They have more roles to play. Myth number 3. Therapy is just like talking with a good friend. Fact check. Yes, talking to a friend or family member is a great starting point of seeking help. In fact, they are the primary resort of help. But sometimes taking help from expert is advised. Myth number 4. Medication is better than therapy. Fact check. Medication is important at its own place. There is no denial of that. But comparing the two courses of treatments is not the right approach. While medication is used in treating chemical imbalance in your body, therapy helps you to resolve the conflict from within. Myth number 5. Therapy is like addiction. Once you start it, you are in for life. Fact check. Now that's not true. Therapy is to make you realize your own inner potential and develop your inner strengths. There is no aim of therapy to create dependence. Therapy is a structured process wherein you build a rapport and by session you see improvement in yourself. Now let's debunk top 5 myths about online therapy. With growing technology, the telehealth platforms have also witnessed a rise. But even to date, various myths revolve around it. Let us debunk them now. Myth number 1. Online therapy is not as effective as face-to-face sessions. Fact check. That's not true. Studies have shown that online therapy is as effective as in-person sessions. The outcomes are likely to bring relief to your symptoms. Myth number 2. There is no rapport or relationship building with the therapist in online therapy. Fact check. You can build relationships and rapport with your online therapist as easily and effectively as with your offline therapist. In fact, they'll try each opportunity to make your online therapy session as effective as in-person ones. Myth number 3. Online therapy is more costly than traditional therapy. Fact check. This is not true. Telehealth costs nearly the same as traditional therapy. In fact, unlike typical therapy outlines, some online therapy platforms also provide with free or trial sessions. Myth number 4. Online therapy is not secure, confidential, and safe. Fact check. The governing bodies have framed guidelines and rules that make sure that online therapy platforms practice proper ethics. They do take your personal information and privacy into consideration. Myth number 5. Insurance companies won't cover for online therapy. Fact check. Numerous insurance companies have now started to work to cover the online therapy services. And with each passing year, more insurance companies are incorporating telehealth services. So, rest assured. We hope that now you have a clearer understanding of the in-person and online therapy. If you have another confusion and doubts, drop it in the comment section below. More power and love to you from CalmSage.